Hello, my name is Leela Ramsey. I would like to welcome you and thank you for your participation in this initiative. In this documentary, we will provide the first phase of Response Initiative Training and Development, specifically designed to increase public health and safety in the event of a regional or national emergency. Due to your involvement in this volunteer initiative, you and your family will be the first segment in your community to receive the necessary vaccines or medication mentioned in the training scenarios. Before every flight, we are all reminded of one universal rule. In the event of a disturbance in cabin pressure, put your oxygen mask on first before helping others. We will need you to put your own mask on first by getting the necessary treatment and then proceed to help others. Getting medicated or vaccinated first will give you peace of mind that you and your loved ones are safe while you help those around you. Disasters such as September 11th and Hurricane Katrina highlight the necessity of having a continuity plan in place.
Continuity of operations are guidelines that ensure that our government can carry on all essential functions in case of a natural or man-made disaster. A continuity of operations plan outlines steps that an agency will take in the event that a disaster happens. Continuity plans require that agencies designate functions that are essential, meaning those jobs that must be performed. Examples of essential functions are healthcare, law enforcement, border patrol, communications, and environmental containment. The government must also ensure that resources associated with a critical function are readily accessible and geographically dispersed. The Federal Emergency Management Agency, or FEMA, is responsible for guiding and reviewing these plans.
FEMA recommends a number of basic steps.
1. Identify those functions that will provide vital services, maintain safety and stability, and sustain the economy. 2. Document plans and procedures for how to continue those functions during an emergency. 3. Outline a succession plan for top management positions and create alternate work locations. 4. Ensure continuity of communications internally, with other agencies, and with the public as necessary. 5. Safeguard information and data by ensuring that electronic records and resources are backed up in case data or systems are damaged. 6. Conduct tests and training exercises to ensure that these backup operations will be successful.
By following all of these steps, we can ensure the safety and security of our communities during an emergency. It is during times of crisis that success is the most tenuous and yet the most critical. In the event of an emergency, 3 key phases of ongoing operations will take place: operations before, during, and after the event. These activities correspond to traditional emergency management phases:
Preparedness, mitigation, response, and recovery. Each one of these functions is critical to the overall success of the initiative. Pre-event involves preparedness and mitigation phases. Activities might include identifying organizations and key personnel necessary to effectively respond to an emergency. Develop and review contact lists, medication inventories, resource shortfalls, reporting requirements, preparedness and response plans, and communications plans. Plan for receipt of the SNS. Train staff and volunteers through workshops, classes, and exercises. Activities during event are part of the response phase. They include conducting epidemiological investigations, providing public health education, implementing volunteer communications and response plans, deploying staff to incident command posts and volunteers to pod sites and vistas, and reporting as needed to other organizations. Post-event activities fall under the recovery phase. Included activities would be demobilizing vistas, pods, and other regional assets, recovering all unused federal assets and returning them to SNS, conducting post-incident reviews, identifying planning and response issues, and modifying plans to reflect lessons learned.
Volunteers are the foundation of any successful response initiative. Volunteers are divided into specific categories to better facilitate assignment of tasks and responsibilities. General volunteer categories include
core and non-core, medical and non-medical, spontaneous, and first responders.
Volunteers will also be assigned to one of 3 general response activities. These will include vistas, FREDs, and pods. Each one of these plays a very important role in an emergency.
Volunteer staging and training areas, known as vistas, are localized sites where volunteers go to receive medication and the materials necessary to work in a pod. FREDs, or first responder dispensing sites, are set up in some areas to conduct dispensing operations for first responders and their families. Pods, or point of dispensing sites, are mission critical and considered the center of operations, dispensing medication, supplies, services, and information to the general public during an emergency.
Finally, in accordance with NIMS principles, on-site responsibilities are divided into 5 basic categories.
1. Command staff. The command staff includes the pod commander, the site leaders, the security officer who keeps the pod running as smoothly as possible inside and outside the facility, the command staff, operations, planning, administration, and logistics, and the safety officer who monitors conditions and develops measures to ensure the safety. Because operations encompasses so many areas of pod's function, the section is divided into 2 distinct branches: Express Dispensing and Special Assistance Dispensing. Express Dispensing oversees medication distribution procedure for the typical population, and Special Assistance attends to individuals with complex questions or with physical or mental needs. The planning section prepares the incident action plan, documents aspects of pod function, and prepares reports for the incident commander. The forms and information teams help members of the public learn about the disease and complete paperwork, and they determine which dispensing line would serve them best. The logistics division takes care of services and support functions, including monitoring the pharmaceutical cash inventory, ensuring that communication systems are functioning properly, and servicing technological needs. The administration section monitors the financial and timekeeping aspects of operations. In addition, the administration chief also oversees the pinch hitters. Detailed descriptions and job action sheets for core and non-core volunteer roles are available on our site.
Each role must be filled, as it is an essential piece of the puzzle. Together, they empower the community to effectively respond in an emergency. Your participation in this initiative helps to ensure we have the resources needed to succeed. Through recruiting, training, and retention, we can develop and strengthen these resources. We are able to protect all that we value, becoming a stronger and better community of one.